is normal in size on the ultrasound. She has a little bit of a leaky valve across her mitral valve. It's something we'll want to monitor, but right now it's mitral regurgitation. It's not really anything that matters too much right now. We were talking about before, one of the major causes of collapsing with exercise is high blood pressure in the lungs. And she has elevated blood pressure in her lungs, but it's not very severe. It's only mild. Normally, dogs with this mild degree of elevation in her lungs would not be collapsing. So it's not something to be like super worried about right now.
But can we do something to just maintain?
I think because her signs seem very consistent with high blood pressure in the lungs. She's collapsing with excitement. She has airway disease. Like when you listen to her lungs, you hear crackles. Her lungs aren't quite normal. She's coughing a lot. I think all of that is consistent with high blood pressure in her lungs. So if we start the medication to treat her, it might stop these episodes, but it might not, since it's not like a slam dunk diagnosis. Mm-hmm. But we know she has mild pulmonary hypertension. It's higher than a normal dog, and she's collapsing, so it makes sense to try the medication and see if it makes her better. Some of these dogs can have some structural abnormalities to their brain, nothing major. Maybe there's a disease process called caudal occipital malformation syndrome. Huge word, basically short for the skull's a little bit too small for the brain, so it pushes on the brain a little bit. Oh. If they're teetering on the edge of normal, which she probably has been their whole life, and then get a little bit of high blood pressure in their lungs, that can be enough to cause them to collapse, because her brain isn't quite normal. So that's why we might be seeing signs in her with this disease versus we wouldn't see it in a dog without
with a bigger
that.
Dog.
And we see Pomeranians all the time with some caudal occipital malformation syndrome and collapse from that. And so it would make sense that that's why she might be more sensitive to this mild pulmonary hypertension than another dog. So that's why we think it's okay to start the medication and see how she does. But I just want you to be aware it might not make everything better. But we've ruled out a lot of very bad things that would cause the collapsing episodes. So that's good. Mm-hmm. We can never rule out an arrhythmia without getting an ECG or an electrical recording of her heart at the time of the event. So that would be our next step. If this doesn't work, if we're going down the cardiology route, which I think we're less suspicious of cardiac disease unless the pulmonary hypertension is significant enough. But our next step, I think we're more suspicious of brain problems if this doesn't work. Like, meaning we might have to start some empiric neurologic medications rather than cardiac medications.
So that means another diagnostic for
No,
brain?
It means that if this doesn't work, follow up with neurology service and they'll recommend other medications for
So you'll give me like a time span of when
2
to
weeks.
do that?
Mm-hmm.
Oh, 2 weeks.
Yeah, because she wasn't collapsing and then she started collapsing, so you should notice a difference within 2 weeks. If she weren't having frequent episodes, it might be longer, maybe 2 weeks to a month. And then if everything resolves, great, we'll continue the medication sildenafil. We'll continue that for long term. If it doesn't resolve, then we'll stop it and we'll give you follow up with neurology and we'll give you other medications to try to see if it gets better. Neurology generally doesn't recommend doing an MRI in these patients because COMS, or the disease I was saying to you, the caudal occipital malformation syndrome, is so common in this breed. They would rather go to other medications. We also don't want to put her under anesthesia to do exactly what we would do with the MRI. So they're going to start these medications before an MRI anyway. So we have steps to take before we would do more diagnostics. So we pretty much have done the diagnostics now.
I'll be so scared to put anesthesia.
They won't want to right now. So that's why it's okay to do this trial. And it might be frustrating and it might be a series of drug trials, but right now we feel much more confident that her heart is essentially very normal. She does have this high blood pressure in her lungs, but it's not causing her right heart to be very big. So right now we're feeling pretty good about her heart, but we also found something that we can treat and potentially make her feel better. It just might not make her feel better. So we just have to see.
About a month or so.
Yeah, 2 weeks to a month, and then you can follow up with neurology and we'll see.
So the medication you're giving has no refill or anything because she has to come back.
If they have pulmonary hypertension, there aren't very many side effects. The problem is if they don't have pulmonary hypertension, it can make things a lot worse. That's why I didn't want to prescribe it without doing the ultrasound of her heart. So the medication can sometimes make them feel a little bit weaker. That's very rare. Very rarely can cause vomiting or diarrhea, but doesn't affect any organ systems, so we don't need to come back to recheck. If you see more episodes, stop the medication and contact us. If you just see that everything's better, then that's fabulous.
Then is she going to continue with it, the medication, or just...
Probably long term. Yeah, we just have to see. We would like to reevaluate her heart in about 6 to 12 months, depending on where you are financially and how well she's doing, just to see, so we can monitor the pulmonary hypertension. We can do that for much less than $600, but just to keep an eye on her. And then the other caveat is we can never rule out an arrhythmia as a cause without an ECG at the time of the episode. Oh. So if these episodes continue...
At the time of episode, that's kind of tough.
It's very tough. So that's why we are like, but if these episodes continue, we recommend going down the neurology route next. But if neurology does their empiric medications and nothing works, the final step is to go back to arrhythmias and do a 24-hour Holter monitor and monitor her heart rate for 24 hours. But it's hard because she's not having these episodes every day. We need it at the time of the episode. It's still not going to be likely to get a diagnosis, and that's $450 for likelihood of not finding anything.
But what is the significance of her neurological stress test that was done? And they said, I don't know, did you have
a stress test? What they did is they did
like
the evaluation of how she was looking after. And so after the episode, she had what's called vestibular disease. Her head was tilting to the side and she wasn't quite normal. And that can happen with primary neurologic disease or if cardiac disease is present. So she had a collapsing episode, wasn't getting enough. That means she wasn't getting enough oxygen to her brain at that time. And so sometimes the brain can have residual effects after that. And the most common cause of the vestibular disease being affected is cardiac disease. So that's why they wanted you to come see us. And so that's why the pulmonary hypertension might not be significant in another dog, but might be significant in her if she has not quite a normal brain from being a small Pomeranian.
Yeah.
But it doesn't mean we necessarily have to treat her brain. It might just mean we have to treat this pulmonary hypertension that we might not have to treat in another dog. So this is the first step.
Yeah, so what we're really after is to see some improvement.
No more collapsing. If she's still collapsing on this medication, it's not the high blood pressure in her lungs.
And I want to see her back and running again because she's not. As you see, she's just walking a little bit
it's more abnormal for cardiac disease to be weak for a long period of time. So that's why we're also more suspicious of neurologic issues. But again, it might just all be worsened from this mild pulmonary hypertension.
Yeah, so it was only this week. She was okay 2 weeks ago.
And it's like the difference between if a child passed out, their brain's going to recover really quick.
Right.
But if an old lady passes out, their brain's going to take a lot longer to recover.
Yeah, she's an old lady.
Yeah, so it's just going to take her time to recover from these episodes. So that's also why we want to stay on top of them. So if you notice any episodes with this medication, we're going to want to do, maybe the first couple of days is okay, but any more after the first 2 days, then we're going to want to switch medications or add in more medications.
What do you think? Sometimes I feed her milk. Is that bad for her?
No, whatever she wants to eat. Yeah.
Just a little bit in the morning, just,
She's in good body condition. She's a little muscle wasted, but she's older, has arthritis. So whatever you're doing is you're doing great with her.
Is she okay to travel though? Because my daughter's saying high altitude may not.
Generally, the pressure is the cabin is pressurized. So if you're in a plane, it's not really a big deal. Unless you're going to the mountains, it's not a problem.
Yeah, because I'm scared to leave her again.
Yeah, you can take her with you. As long as it doesn't stress her out, you can give her the trazodone before you go, and that can relax her.
Trazodone? Is that something?
Trazodone? Oh, did you not actually have it? Dr. Bloom had recommended at one point it's a medication to take to reduce anxiety.
Oh, can you recommend that? I didn't see that.
You can give her extra Vicodin as well because that will sedate her.
So I can get a prescription.
I refilled the Vicodin Vicodin for you.
So it's a Vicodin is the same as the Trazodone?
No, Trazodone is different, but if the Vicodin sedates her so much, that's actually probably better for her because it'll stop the cough and sedate her, and you can give her that for travel right before you travel.
Okay, because my daughter's like panicking. I'm gonna bring her, so, but I'm panicking more to leave her because this thing happened when I
When
left
are you
her.
bringing her?
Oh, not until Thanksgiving.
Okay. Well, let's
So
hold off
we
because I
would
don't
know.
want to rock the boat with extra
Yeah.
medications yet
Yeah,
without
okay.
knowing exactly what's going on. But before you're traveling, we can definitely give you some trazodone or some anti-anxiety medication if you need it. But I think that sticking with the Vicodin is probably better for her.
I think so. Yeah. So, all right. I guess